We are very proud at the Royal Free to be one of a small number of organisations that has been given the opportunity to establish a group of hospitals as part of the National Vanguard programme. Our ambition is to become Europe's highest and best performing healthcare group, and how we will define that is that each of our hospitals will be regarded as outstanding in the eyes not just of the patient but as the eyes of the CQC, the Care Quality Commission, the organisation that assesses quality in hospitals, and also we will have a reference cost and a cost base which is 10% below the national average. Therefore really providing excellent value to taxpayers and an excellent outcome and experience for everybody who accesses any of the hospitals across the group. We've been working with things called clinical practice groups. The basis behind our clinical practice groups is clinicians are brought together, they come together around data, they work out what good looks like, they implement it, they embed it in the workflow processes, it's digitalised, and they continuously measure and aim to improve their performance.
I'm so excited about clinical practice groups because this is the very first time that we as clinicians have all been able to work together to truly map out the entire journey that a patient takes from the moment that they see their GP to their final diagnosis and their final treatment. And we've been able to work out all of the frustrations, the inefficiencies, the waste and all of the repetition that patients have to deal with on a daily basis. And with that in mind, we've been able to entirely redesign all of the pathways with patients in mind. By cutting out that waste, of course, the NHS is going to benefit, but most importantly, patient experience is going to be so much better.
A really good example of that is the work that we've been doing in the neonatal unit with the doctors and the nurses and the physios and the helpers and the assistants, and the parents themselves have come together to look at how we can work to minimise the number of occasions we separate a child from its mother at birth.
On the neonatal unit, we look after premature babies and babies who are born at the right time but who are poorly and need our services. These are vulnerable babies, and we are working with parents to help them understand why they need the extra support so they can provide this care together with our maternity teams. We're working with other hospitals in the group to share expertise and develop a pathway that is really easy to use for our staff to achieve the aim of keeping our mothers and babies together.
One of the things which will characterise the Royal Free London Group, and I think is true of the other hospital groups, is that we will absolutely embrace and be at the leading edge of the digital revolution. I think we need to put our hands up. The NHS has been a little bit behind on this stuff. We are absolutely going to embrace it as a way of ensuring that we use data to make our decisions, data to drive our care, data to inform the way that patients are treated, and not just what they receive but where they receive it.
We're here on the Chase Farm site, a brand new hospital under construction. Our ambition is to make this one of the first fully digital hospitals in the UK. In this new digital world, we'll be providing doctors and nurses with digital clinical pathways. They'll have mobile clinical records, and patients will have access to their appointments and other information at home.
So what's this all about? Where's it all going? I think we are running the most profoundly important experiment in the NHS. I think if we get this right, we can genuinely be setting the template about how services will be run well into the 21st century. I'm really proud and privileged to be given this opportunity. I think we're off the blocks, it's going well, the clinicians are embracing it, we're really starting to make the dial move on key metrics about quality, experience and costs. So we're off. So keep with us on the journey, keep with us.